I'm Dr. Kathy Canty. I work here at Family Health Services, and we're here today to discuss breast cancer screening and answer some questions about it. So you are more than welcome to bring us any questions, any physical findings, family history, any concerns about breast cancer screening that you would like to discuss. This is just an overview of screening recommendations. So there's a lot of different recommendations out there from different societies about breast cancer screening, and it can get really confusing. We here at Family Health Services are here to listen to your concerns and your personal history and to discuss all the different recommendations and make a plan that works for you for breast cancer screening. So there's a lot of questions and confusion about when to start breast cancer screening. Several organizations recommend starting at 40 and doing it every year thereafter. Some people are more comfortable with every 3 years after 40. Some people don't start until 45 or 50. A lot of different recommendations, a lot of different personal feelings and histories. We're more than happy to go over all of that with you and discuss the right answer for you. So you might consider while you're waiting whether you have any personal risk factors for breast cancer. Family history is an important risk factor, specifically any first-degree relatives, mothers, sisters, daughters. The BRCA gene, if you have a family history of that, it specifically could change our recommendations. Smoking increases your risk for breast cancer. Any trauma to the chest, any radiation therapy to the chest, specifically between the ages of 10 and 30. Obviously, any personal history of breast cancer would very much change things. It's important to just consider your different risk factors and bring them to the table so we can assess everything and make a recommendation. So people always have a question about whether they should be doing self-exams of their breasts. The experts recommend against it, actually. They have found that people find lumps that are not clinically significant that would otherwise not be worked up. And these can lead to biopsies and surgical procedures and studies that don't necessarily need to be done. Obviously, if you feel very strongly that you need to do a clinical breast exam, then I'm more than happy to discuss those findings with you and make recommendations based on them. As your first step in clinical breast cancer screening, you will come to Family Health Services and discuss with your provider your different risk factors and the different recommendations from expert societies, and you'll make a plan for breast cancer screening that's right for you. We do not perform the screenings themselves, the mammograms and the ultrasounds. We're more than happy to find a place locally to refer you to for those breast cancer screening procedures. If you're worried about the expense of breast cancer screening, there are many options and foundations that are here to help with that. We'd be more than happy to help you find resources. So there's a couple of different ways that we can examine and image breasts. One is an ultrasound. That is used more often for a lump that is of concern. That is where the transducer for the ultrasound, they use gel and they actually maneuver it to get a good look at the lump so that they can better classify it. There is also mammography. There is 3D mammography and regular mammography. That is the exam where they compress the breast tissue to get the images on the x-rays so they can detect early breast cancer. Once you've had the imaging done of your breasts, these will be sent electronically usually to your provider who will examine them, and we will find and call you with the results and recommendations. We here at Family Health Services are here to be with you through the entire process of breast cancer screening, to make a plan for how best to screen you, all the way through to receiving the results and the recommendations of that screening. If you have any further questions, please feel free to reach out to your provider.